Hello, welcome back to Health Talk. Do your hands or feet feel cold even when the weather isn't cold at all? You wear socks, other people around you feel completely fine, but you're still freezing. If this happens often, you might be wondering, is this normal, or is something wrong with my body? Cold hands and feet are actually very common. Most of the time, it's harmless. But in some cases, it can be a signal related to circulation, hormones, or nutrient levels. So today, let's break it down clearly and simply, when cold hands and feet are normal, and when you should pay attention. The most common reason is temperature and how your body protects itself. When your body feels cold, it automatically sends more blood to vital organs like your brain and heart to keep them warm. Your hands and feet are further away, so they receive less blood and feel cold first. This is a normal survival response and doesn't mean you're sick. Even mild air conditioning can trigger this in some people. Another very common cause is stress and anxiety. When you're stressed, your body enters what's called fight or flight mode. Blood vessels tighten, blood flow to the skin decreases, and suddenly your hands and feet feel icy. What's interesting is that this can happen even if you don't feel anxious mentally. Your body may still be reacting to stress without you realizing it. Body type also plays a role. People who are slimmer or have lower body fat tend to feel cold more easily because there's less insulation to retain heat. This is especially common in women and is usually not dangerous. It's simply how the body is built. Now let's talk about health-related causes. One possible reason is poor circulation. When blood doesn't flow efficiently to your hands and feet, they can feel cold, numb, or even slightly pale. This can be more common in people who smoke, people with diabetes, or those who sit or stand for long periods without much movement. Another very common cause is iron deficiency, also known as anemia. When iron levels are low, your blood carries less oxygen around the body. This can lead to cold hands and feet, tiredness, dizziness, and pale skin. This condition is especially common in women and often goes unnoticed until blood tests are done. Thyroid function is another important factor. If your thyroid is underactive, your metabolism slows down. This means your body produces less heat, making you feel cold more easily, especially in your hands and feet. People with thyroid issues often also feel tired, gain weight easily, or feel sluggish. Sometimes, the issue isn't blood flow but nerve sensitivity. Certain nerves may become more sensitive to temperature changes, making normal temperatures feel extremely cold. This doesn't always mean nerve damage, but if it's persistent, it's something to monitor. So when should you worry? Cold hands and feet may need medical attention if they come with warning signs such as color changes, like white, blue, or purple fingers or toes, persistent numbness, pain, tingling, weakness, or wounds that heal slowly. If these symptoms happen often or get worse over time, it's important not to ignore them. The good news is that many simple habits can help. Keeping warm, moving regularly, managing stress, staying hydrated, and eating balanced meals can make a big difference. If symptoms continue despite these changes, basic blood tests can help identify common causes like anemia or thyroid issues. In most cases, cold hands and feet are not dangerous. But your body is always communicating with you. Learning to understand these signals helps you take better care of your health. If this video helped you understand your body better, consider subscribing for simple, clear health explanations every week.